Right, good afternoon, everyone. It's a pleasure to be part of this event, very well organized, so thank you for that. I didn't know what to expect when I accepted the invitation, but I'm pleased that we brought in so many perspectives, really, and I hope the research that I'm going to talk to you about will add to that. But first, let me introduce myself. My name is Lucian Milasan. I am a mental health lecturer at Nottingham, Trent University. I am also an early career researcher with an interest, and I would say passion for student mental health, and that comes from about 10 years of working as a mental health support, student support worker and advisor. So I conducted this study with Ed Griffin. Ed, unfortunately, wasn't able to join me today. Ed is a lecturer in psychology at Nottingham Trent University. And just to confuse you, Ed, the DMU logo as well, the Montfort University, because coincidentally both Ed and I were working at DMU when we were conducting these studies. So that explains it, that's where we have the ethical approval from. Right, let's see what can we pack in 10 minutes. I think I'll try to speed up. Let's start with the aims, so what we try to achieve. Basically, the generic aim was to explore the impact of the COVID pandemic on student mental health in UK-based students. And more specifically, we looked at examining student mental health challenges, but also benefits. So we left the door open there for potential positive impact of COVID, investigating students' coping mechanisms to see how they actually coped with the challenges to their mental health, and finally to explore their perception on the support received from their universities. And for that purpose, we designed a bespoke questionnaire, 66 questions. Yeah, I know it's a lot, mostly quantitative, so there were more tick boxes, Likert scale, that kind of thing, and 12 open-ended questions, which were optional, so students could answer or not the open questions, and we were surprised to get a rich qualitative data, a lot of textual data through these questions. I forgot to mention that the study was conducted at the end of the first lockdown, if you remember. I'm quite sure you all remember it. That was end of May, beginning of June. That's when the survey was open. Initially for 2 weeks, but because we have so many respondents coming through, we decided to just leave it for another week, and we didn't regret that. So that's the time frame of the project. Now, we wouldn't have been able to recruit students without help, and I think this is a great opportunity to thank Human, the University Mental Health Advisors Network, SMART, and quite well represented here, I understand, and NUS, Healthy DMU is the student support services at the Montfort University, who helped us to make links with all these organizations, and the mental health, yeah, very helpful with Twitter, helped us cascading the link to the online survey. And obviously student unions, student support services across the UK, and obviously students who took part and invested some of their time and effort into this. So great opportunity to thank all involved. I have to mention that we recruit not just students with mental health problems. The survey was open to all students. So although there is a tendency for people with lived experience to answer to this type of surveys, we had probably around 50% students without any diagnosed mental health problems. In terms of representation, you can see clearly there at the top of the first chart bias, slight gender bias, which is quite difficult to control when you just throw in a link to a survey out there. So female students tended to respond more to the survey, a percentage of almost 80%, so quite a clear difference. Mostly undergraduate students, but we had 1 in 5 students postgraduate, full-time, and mostly home students. International students, unfortunately, not that well represented, and we'll talk about that in a minute. Age range, 17, 62 years old, average around 25. So students from all age categories, really, and ethnic backgrounds, which, again, we think that was a bit underrepresented. Mostly white British, 70.7, and I think there were about 13% are the white backgrounds, so not a lot left in terms of ethnicity. But building on that limitation, because we thought that that's a limitation to the project, we decided to look into the experience of mental health in students from Black and Asian and minority ethnic communities. So watch that space. It's a qualitative study coming, so hopefully next event you'll have another abstract submitted. I have to say that Ed was the quantitative brain of the project. I'm more into qualitative research methods, so that was, I think, a good combination which helped us design this study in two phases. So phase one was more around statistical analysis, quantitative data, using SPSS, and the second phase, thematic analysis, so analysis of textual data coming from the open-ended question, which worked quite well together, and I decided to present it in kind of an alternate way. So I give you the numbers, and then I'll explain what's behind the numbers with data coming from the qualitative phase. Speaking of which, let's have a look at what we found. And I would probably start with quite a staggering percentage of about 60% almost students experiencing or describing their psychological health as poor or very poor during the restriction period. I remind you that's end of May, beginning of June 2020. Now, the chances are that some of these students experience mental health problems before the pandemic started, and for that reason we asked a second question there, which highlights that actually the psychological well-being of these students has been deteriorating during the COVID pandemic. So that indicated that there's something about the pandemic, about the circumstances that contributed to this deterioration in mental health. Talking about experiences of mental health, so we talk about low mood, so signs of depression experienced over a period of more than 2 weeks in about 2 in 3 students, which was quite high in our opinion, and a similar percentage, probably even higher, students experiencing anxiety. So we talk about 2 in 3 students experiencing depression and or anxiety, because some students reported both mental health problems. In terms of influential statistics, so Ed probably would have been able to explain this a bit better, but we identify no significant difference between males and females in terms of psychological health. Although there were more male students reporting or not reporting a mental health condition than females. So the disclosure, and probably that's supported by the literature, comes more from the female students. However, we identify a small positive correlation between age and psychological health, which indicates that mature students might have coped better with the mental health challenges during the COVID pandemic, and I hope the qualitative data will answer why that's the case. Now, with regards to data from students from Black, Asian, minority ethnic communities and international students, I'll probably take that with a pinch of salt, and the reason for that, if you remember, we had quite small samples, so conducting statistical analysis on 40 students from this community probably wouldn't be very relevant. But having said that, in relation to international students and from their qualitative answers, we deducted that they coped better with mental health issues compared to home students, for example. Now, there might be a cultural bias, because I think it was mentioned earlier on that we understand mental health in different ways, coming from different cultures, so probably it's an element of that as well. What are these challenges about? Because we keep talking about challenges to mental health. So from the qualitative data, from the answers to the open questions, unsurprisingly, most of the students who answered that question identified isolation and loneliness, which I think is a theme already from what I remember from the previous talks. And then dealing with change and uncertainty, which explains the high scores for anxiety that I was talking about. And students describe their experience as a kind of a battle through academia. So they were studying remotely, reduced support with their mental health and academic support as well, and increased stress, obviously, especially around assessments, for instance, because there were a lot of changes, like exams, in-person exams being changed to online coursework, so things were a bit upside down at that point. And again, a number of students described their challenges in terms of distancing from mental health support. And that includes mental health support from universities, counseling, psychotherapy, and problems with coping mechanisms. And I'll give you an example. For instance, someone with social anxiety uses social exposure or gradual social exposure to cope better with social kind of situations. But obviously during the lockdown, when we weren't able to see anyone, that was put on hold. So basically they didn't have the chances to practice that coping mechanism. So the general feeling was basically of being stuck. Now, stuck, if you look at the last quote here included on the slide, some people were stuck in environments that were negative. So they weren't conducive to mental health or academic progression. Or if you're feeling stuck in their minds, so there are a lot of negative feelings and negative thoughts that fed into kind of a constant negativity that explains some of the problems they experienced. Okay. Now, if you look at this slide, yeah, I think the differences between students identifying challenges and students identifying benefits is quite striking. So a small sample of students identify some benefits from these connections. Now, some students, again, students with social anxiety, for instance, coped better with the challenges of COVID because they didn't have to deal with people. So some people being away from social situations helped quite a lot. Or connections in terms of students connecting more with the nature, for instance, so that type of connections. The pandemic was for some students an opportunity for reflection and resilience building to normalize their life. And when I say normalize, you'd be surprised that some students said that their life during the lockdown was actually more normal compared to the pre-pandemic. You agree? Yeah. So there were some reasons. I mean, people said, I was spending more time with my family. I had time to cook healthily, to eat healthily, exercise regularly. So sleep hygiene, again, everything was better actually than pre-pandemic. So there was a number of students actually coping better, especially mature students that I mentioned earlier on. And that links to renewed routines, which means that some students actually found time to get involved with like creative activities and things that actually were helping their mental health. So they kind of reshaped their life in a way. Now, going back to students who struggled with their mental health, I mean, they didn't quite suffer in silence there. Obviously, probably their voice wasn't heard at that point, but students were doing something. So a feel from this study was that not everything was doom and gloom, if you want. I mean, there was some resilience building there, and part of it is just using these coping mechanisms to face the adversity, if you want, of the COVID pandemic. And you have healthy routines there. I mentioned healthy diet, exercising, sleep hygiene, that kind of thing. Alternative therapies, probably you wonder what that is. Now, we had a wide range of activities that people were getting involved in, like the art base, you know, drawing, painting, crafts, photography, grounding. I had to look that up. I don't know what grounding is. Do you know what grounding is? Someone said, yeah? So, do you want to explain it? Probably I'll get it from you as well, yeah?
Grounding means sort of centered,
Mm-hmm.
balanced.
Connection to Earth, that kind of thing, yeah? Brilliant. So it's grounding, journaling. Probably you are doing journaling, some of you already. So journaling, actually expressing feelings in writing. I think there is a quote there, the last one, which I'm not going to read out loud for you, but probably when people revisit this slide, they might pause the presentation and take these things a bit more their own pace. Right, just a quick view at the academic support. So surprisingly, although 23 students experience mental health problems, only 1 in 3 or even less requested support for their mental health from the university. And from people who accessed, or students who accessed support, 45% approximately were happy with the support received, 55 not so much. And the reasons for that were around lack of responsiveness, blurred communication, lack of reasonable adjustments, and support being seen as a kind of a tick box exercise. People were feeling treated like a number in statistics. It wasn't a personalized type of support. And some positive perceptions as well around continuity and consistency of support, understanding individuality, and accessibility as well. And yeah, it's a long story. I'll leave this slide just while we take some questions. Probably it would be would work a bit better, yeah? Yes. If that's all right. And thank you all for your attention. Sorry for rushing it. This is empirical evidence. There's never enough time to talk about mental health.
Thank you very much. It's very, very interesting.
Thank you. Thank you.